Hi, my name is Shelley McAllister, and I would like to welcome everyone for joining us on the call today. We are so excited to present this webinar to all of you. We've had a collaborative effort of people that both work at the American Cancer Society, and then our three guest presenters and the wonderful stories and the wonderful work that they've been doing on increasing colorectal cancer screening with their own employee population. We're really excited to put this together, and so welcome. I wanted to let you know that through the course of the call, if you have any questions, you can submit those on the bottom right-hand side of your screen in the Q&A box. We're going to have a Q&A session at the very end of the presentation. We'll get to as many of those as possible. So please feel free to submit your questions in that way. So my name is Shelley McAllister. I'm a Senior Product Manager with your American Cancer Society. I lead a portfolio of cancer prevention and early detection programs and tools that are delivered to employers like yourself, also hospitals and other community systems too. The focus of my portfolio is tobacco primarily, but also nutrition, physical activity, and also cancer screening. And we do that through behavioral change programs, policy assessments, and communication tools. So our agenda today, I'm going to go through the employer strategies for success. Then we're going to hear three really compelling stories from Ameren, from AT&T, and also from Progressive Insurance. Then we'll hear some pledge news, 80% pledge news from Mary Dorshank, and then have that Q&A that I mentioned previously. So at the end of this webinar, we hope that you will understand the latest statistics on why it's important for your company to take the 80% pledge. Also know the steps that you can take to increase colorectal cancer screening rates at your company. Implement effective and innovative strategies with your own employees after hearing compelling stories from the three companies that I mentioned previously. But before we start looking at the strategies that you can use, let's understand the business case and some recent related research done by the American Cancer Society. Of course, nearly everyone in your company has been touched by cancer in some way. We all have, either if it's not personally or through the experience of a family member or friend or a coworker. Colorectal cancer is the third most common cancer in both men and women. In addition to the physical, the emotional, and the psychological impacts of a cancer diagnosis, cancer is also responsible for $130 billion a year in lost productivity due to premature death. Costs for 1 year of late-stage treatment for colorectal cancer can be as high as $571,000. And for the working population, or for those 65 and younger, our country spends over $7.4 billion each year in colorectal cancer treatment. Screenings are tests that look for cancer before signs and symptoms develop. Hopefully everyone on the call that's over 50 or over 40 and in a high-risk group has already been screened. So you're familiar with this, but for everyone else, colon screenings can often find growths called polyps that can be removed before they turn into cancer. These tests can also find colorectal cancer earlier when treatments are more likely to be successful. Regular screening for colorectal cancer can reduce the number of people who die of this disease by at least 30%. By encouraging your employees to get screened, to get the cancer screening test and to help prevent cancer with everyday lifestyle choices, your company is taking an important step toward creating a healthier workplace. And as you all know, healthy employees live longer, feel better, are more productive, take fewer sick days, and also help keep healthcare costs down too. So this is some of the research that was done by Stacy Fadua and Ann Goding-Starr, who are epidemiologists from the American Cancer Society's Intramural Research Department. They recently published an article in the Preventive Medicine Journal reviewing disparities in cancer screening by occupational characteristics. This PowerPoint and the recording was going to be posted on the NCCRT website at the end of, within like the next 24 to 48 hours. So if you're interested in learning more about this work, there is a link to this publication near the top of this slide. and I see that it's not displaying the way that I was anticipating it to, so let me just read through some of this. In the construction, the food service, production and transportation, and then also the healthcare and personal support occupations, people in those occupations reported less than a 50% screening compliance compared to management, business, community and social services, healthcare practitioners, educators, and scientists, which reported 65% or more screening compliance. So we do see screening compliance differences in different occupations. Some of that, what we can attribute to is employees that achieve a high school diploma or less, or also who, and/or who were also uninsured, are less likely to be up to date on cancer screening recommendations. So we've seen the case to increase colorectal cancer screening in your employees, and we've also learned more about current screening prevalence by occupation type. But what's next? How can we take this evidence and turn it into actionable steps to increase colorectal cancer screening at your company? Well, you're going to hear 3 really great stories in a minute, but first I'd like to just overview what we call the 5 steps to success that an employer can take to educate and support colorectal cancer screening among employees. These include making the commitment to the initiative, determining your current screening rate, taking evidence-based actions, tracking your screening rate over time, and then also sharing your success. So the first step is to make the commitment. If you've already committed to the 80% pledge by signing the pledge or agreeing to work on this initiative in your company, you've already taken an important step. Signing the pledge officially is not a requirement. If it becomes a barrier, we don't want it to be something that precludes you from working on this initiative with us. But if you'd like to make it official, you can go and sign the pledge online at nccrt.org. There's also a sample press release that you can use to announce your company's commitment to your community. And this is also something that you can use as a great way to kick off your commitment with your employees. So the second step is to get started, and that really includes trying to determine what your current screening rate is for colorectal cancer within your employee population. When you're determining your screening rate, you have to keep in mind that there's no perfect method for calculating rates. Quarterly data is helpful if it's available, but minimally you should have at least annual data. If you have a wellness team, they could be helpful in working with insurers to analyze data on screening rates for your eligible employees. Another option, might be to consider a staff survey or other health risk assessment that asks if staff are up to date with their screening. It's also important to understand screening coverage under health plans for your employees. Current insurance law requires private health insurers to cover recommended preventative services without any patient cost sharing, such as copays and deductibles. Colorectal cancer screening is one of these covered benefits. If you have part-time or benefit ineligible employees who do not have coverage, you can refer them to the resources found in the 80 by 18 Employer Challenge Guide, which is provided by your ACS staff partner. If you're not already working with an ACS staff partner, we're going to have some instructions for you at the end of this webinar. The third step is to take action, and that means educating and promoting screening to employees at least twice a year. Your promotion should include eligibility recommendations, colorectal cancer testing options, which is super important because there are more options besides a colonoscopy, and that's something that we've really been working hard to get the word out about. And you'll hear more about that from some of our employer stories as well. You also want to promote what insurance covers and then set up a way for employees to report their screening status to you. Some of the ways that you could promote could be emails, you could do e-birthday cards, screening reminders, lunch and learns, social media messages, leadership messages like a letter from your CEO or from your other senior leadership from your company is great, or you could host an event to sign that 80% pledge that we mentioned previously and announce your company's commitment to staff. So we know that research has shown that the messages on this slide are effective in motivating people to get screened. The Communications Guidebook, which also includes other tested messaging specifically for priority populations like African Americans and Spanish speakers can be found on the nccrt.org webpage or through a link in the 80 by 18 Employer Challenge Guide. You can also visit a website called myoworks.org. That's MIYOWOKS.org to create customized messaging for the specific populations you're targeting with your employee group. We worked with Myo, or Make It Your Own, to provide tested colorectal cancer screening messaging. And so Myo delivers industry standard production-ready files for print, web, and interactive applications. So you can really go into that website and customize messaging that's specific to the type of employee population that you're trying to target. Some of the items that are available are flyers, inserts, posters, postcards, question cards, and also web banner ads. So the final two steps are to track and to share. So it's best to track your screening rate, like I mentioned before, each quarter, but if not, at least annually, because the more that you can see if you're making progress or maybe you're not making the type of progress that you were hoping for, the more often you can see that, the more that you can make adjustments on your action plan. Small successes, of course, can and should be celebrated. That forward progress is so important in building on the momentum of that as well. The final step is to talk about the great work that you're doing with your employees and your community. Many employers appreciate hearing how others are helping their employees be healthier. We get questions like that all of the time when we're out there in the field talking to companies. They want to know who else is doing this type of work, like this 80% screening initiative, and how are they doing it, and what have they learned. And one of the reasons why we decided to provide this webinar today, because we know that learning from others can make a big difference. So now I'd like to start with the first of our 3 employer stories on how they've increased colorectal cancer screening rates at their companies. First off will be Lisa Rosalind, the Senior Manager of Healthcare and Benefits Operations. She leads the Healthcare Benefits and Wellbeing teams at Ameren. She's worked on the employer side of health benefits since 2005. Prior to joining Ameren, she worked for many years in the health insurance industry, providing benefits administration and customer service to large national clients. She has a true passion for improving health, and we're so excited to have her join us. So, Lisa, go ahead.
Great. Thank you so much, Shelley. I'm glad to be here today to share some of our experiences. Ameren's an energy company based in St. Louis, Missouri, where we provide gas and electric service to nearly 3 million customers across portions of Missouri and Illinois. We have about 8,600 active coworkers. Approximately 75% of those are male, with an average age of 47. With that, we have a significant population in the target range of age 50 and older for the colon cancer screening. About half of our coworkers work in power plants or out in the field. You know, they're not sitting at a desk or using their computers in their daily work. Ameren's mission is simple. We power the quality of life, and caring about the well-being of our coworkers is key to our success. Our CEO has been very active in the CEOs Against Cancer group and brought this campaign to my attention pretty early on. Back in 2016, we signed the pledge to help reach the 80% goal and immediately set out to create a communications plan to get us started using those steps to success that Shelley just talked about. We looked at our 2015 year-end results from our health plan, showing that only about 58% of the applicable population had actually been screened, and we knew we had a real opportunity to help stamp out colon cancer. Our action plan consisted of using many different channels, trying to reach people in a variety of ways. We used some of the materials that were provided by the American Cancer Society, like this table tent that we placed on tables around our cafeterias. In addition, we used some other methods like digital signs in our buildings, newsletters, posters, those kind of things. We also created some of our own materials to align with our promotions, such as this one. It was a special offer we did on whole grain oatmeal cups. We offered them at a discounted price for the month of March during Colon Cancer Awareness Month, just to help people become more familiar with colon cancer screening. And we used the tagline of "Feed your colon whole grains." One of our many employee resource groups is a multi-generational group, and they helped us to promote this awareness more directly toward those that are in the appropriate age range. We've also partnered with other employee resource groups on broad well-being campaigns, and some of those groups are focused more on veterans, women, or minorities. Here you can see a few more examples of some of our tactics. We ran a campaign at our wellness fair asking coworkers to sign a pledge to be up to date on their own colon cancer screenings, or if they weren't eligible, not yet age 50, then just to remind someone that they know about the importance of being screened. Everyone who made a pledge was entered into a drawing for an autographed hockey stick from former Blues players Bernie Federko and Bobby Flager. At the end, or at the bottom here, is an example of one of the digital signs that we used, again, to encourage screenings and drive people to talk to their doctors. One of our more impactful campaigns has been a targeted mailing from our health plan directly to coworkers or their spouses who are age 50 or older and have not had their colon cancer screening. Our plans provide full coverage for the procedure, as Shelley mentioned, which really helps to minimize any cost barriers. And the letter included information about the value of early detection. In September of 2016, we sent out just over 2,500 letters, and 1 year later, 246 of those participants had actually had their screening. We did just recently send another set of pretty much the same letter to anyone who still had not obtained a screening, plus anyone new who's aged into that applicable group. So from our starting point of 58% at the end of 2015, I'm thrilled to report that we've increased our results to 70%. We're still shy of the 80% goal, but we're encouraged by the progress we've made so far, and we're committed to continue using a variety of methods to reach the people who need to be screened. We're sharing the impact of our efforts through community initiatives such as the local business journal's Healthiest Employer program and the CEOs Against Cancer chapter meetings, really highlighting our efforts to educate about how colon cancer can be prevented in so many situations. Our challenges are probably not unique. Colon cancer is not really a topic most people bring up at the water fountain, and many shy away from the stories they've heard, perhaps, about colonoscopies. But we're working to make it okay to talk about this important step that we can all take. Reaching our coworkers who are out in the field creates its own set of challenges. We've learned that there are things that we can do to remove or minimize some of the barriers, such as providing the 100% coverage and making the difficult conversations a little easier with humor, such as our Feed Your Colon campaign. The letters directly from the health plan also seem to get people's attention more than our broad sweeping messages. On a personal note, I, like so many others, put off having my screening for almost 2 years. When I finally did undergo the procedure, polyps were found and, of course, removed. As a result of my heightened awareness around the importance of catching things early, I had a conversation with my own siblings just to be sure that they weren't also putting it off, and learned that my brother had indeed had the same experience, finding polyps. So that drove home for me just how important it will be for all of us to stay on top of our screenings. For anyone who's been reluctant, my best advice is just do it. It could save your life. Thank you.
Thank you so much, Lisa. That was great, and we're glad you got that taken care of, and thanks for being an extra special champion for colorectal, for everyone going and getting their colorectal cancer screening.
Thanks.
Yes, so let's go ahead and move to AT&T. We're going to hear from Levin Gunter, who is the lead benefits consultant. He joined AT&T benefits team in June as a member of the Your Health Matters group. Together with his colleagues, he works to drive awareness and engagement across the company in wellness programs and healthy lifestyle choices. Prior to joining the team, he held a variety of positions, including a role in the corporate university. Excited by his time engaging with employees for their education and advancement, he happily joined the Your Health Matters team to continue connecting employees with resources that they can use to better themselves. Levin received his bachelor's degree in psychology before returning to school to receive his MBA at BYU's Marriott School of Management. He's an active user of the company health plan, covering himself, his wife, and 4 littles, and resides in Dallas, Texas. Go ahead, Levin.
Thanks so much, Shelley. Let me start off by saying it's not very fair to have to follow Lisa, but I'm excited to be here and talk about what has happened here at AT&T, our commitment to the 80 by 18 campaign, what we've done, and some of the successes around that. So to set the stage for everyone, I don't know how much of an introduction we need, but AT&T is a global TMT company, or technology, media, and telecommunications. And the mission of our company is to connect people with their world everywhere they live, work, and play. As a large employer, we directly employ over 250,000 people worldwide, of which about 55% or so is unionized. And so all that to say, we do have quite a diverse workforce working for AT&T. And so there's no real one-size-fits-all answer for this. So that's just kind of to set the stage for what we at AT&T saw when we began the campaign. Some of the considerations for AT&T are, first and foremost, what kind of an employer do we want to be, and what kind of total rewards package are we offering to our employees? Total rewards meaning, you know, pay as well as benefits and everything that goes into working for AT&T. And at AT&T, we feel like we have a competitive offering, and one of the things that makes it competitive is our health care and the way we do care for our employees' health. So that's just kind of a background piece of information. We're all in. AT&T spends $5.5 billion every year paying for the health of our employees through our medical plan, and so, or over that amount. So it's something that AT&T takes very seriously. As part of that coverage, as with a lot of employers, all preventive screenings are covered, and colorectal cancer screenings are among those. So when the opportunity came up for us to join in this push and campaign to say that we commit to helping stamp out colorectal cancer, we were excited to jump on board, and we signed the pledge in January of this year. So to set ourselves up for success, we started measuring where are we today, and looking at employees who were covered and 50 years or older. We saw that our rate of screening was at about 44%, and that looked at all kinds of colon screening or colon cancer screening tests. And, you know, depending on the test, for instance, if you have a colonoscopy, we look back about 9 years. And so if somebody's had one in the last 9 years, they're considered screened. So 44% of our people have been appropriately screened starting in 2016 when we started to measure this. And so we decided to start things off kind of with a big splash. And that big splash took place actually in November of 2016. We had a senior leader at the company by the name of St. Marshall, who actually at a company event was encouraged to get a screening done, and at the encouragement of some friends and accountability buddies, she had that done shortly before her 51st birthday, at which point in time they discovered stage 3 colon cancer. So she quickly surfaced at the company as a champion for this cause. And so in November, we brought her together with a moderator who's a well-known personality from around the company. His name is Charles Bassett, as well as two experts on cancer. We had Dr. Winder from the American Cancer Society as our expert on colorectal cancer, and Ben Jackson. And so at this panel, we had an hour-long discussion between conversation and Q&A, where people were able to ask and engage, and this big splash event really made a lot of noise around the company, because at the end of the event, Charles Bassett, the moderator, was approaching his age of eligibility. He decided to commit to getting screened when he was eligible. So we kind of had this big event. We let everybody know, hey, you know, this is a thing, and once the event ended, there was a commitment moving forward by one of the main participants. And so moving into 2017, we continue to use celebrity and large-scale communications to help push this message. So in March, during National Colon Cancer Month, or Awareness Month, we had Dr. Winder come back, and he put out a public service announcement that we broadcast and published to all of our people through our main media channels. And he addressed it directly to AT&T employees, talking about the importance of getting screened. During that month, we also had a follow-up. Charles had his 50th birthday, and with that, he was eligible to go and get screened. So he plugged it in the mainstream news broadcast that he's a part of, saying, hey guys, I went and got my screening and everything was good. You see he's giving a thumbs up because everything turned up daisies for him. Also in the month of March, St. Marshall participated in and recorded a broadcast that was then, it was a radio broadcast that was sent out over local stations here in the area. So we had quite a bit of splash, and all of this was being driven through our social media platform internally so that the conversation could happen at all levels, not just at the top, but everywhere throughout the company. And so we like large, broad-scale communications. And so, again, we had an opportunity to utilize a partnership that we have with the NCCRT and publish a blog post talking about our commitment to the 80 by 18 campaign that went active this month and is out there for anyone to go and read if they're curious, talking about what we've done, some of the steps we've taken, and then also some of the steps ahead. So we continue to push these large-scale communications out, which being a communications company, I think is appropriate for us. And so coming December, we also have another message that's going to be going out from Charles Bassett, where he details his story and once again talks a little bit about going and getting screened and his decision to make that effort. And so to wrap things up, I wanted to kind of cover what our progress has been, some of the victories that we've seen, and then possibly even talk about some opportunities and next steps. So again, our screening rates, we have seen an improvement of 600 basis points. In other words, we started out at 44%, and through our efforts, we've seen an increase of 6%, which comes to a total of around 2,000 employees who've gone out and taken the plunge. So quite a bit of impact, although, you know, still a ways to go until 80%, but moving the right direction. We feel like one of the things we've done well is to find internal champions and create these homegrown heroes who everyone can relate to and who they know from the company, and communicate that out broadly. I think all these things that we've done have helped to decrease the stigma by having such a frank plug go out across our media channels to go and get screened, and to have it be modeled first by these personalities. It has done a great deal to decrease the stigma around going and getting screened in one way or another. I think some of the opportunities facing AT&T at this point are to improve our targeted communications and to get that message to that person's inbox at that time. And so we have partnerships with our health plans that do already exist and do go out around the birthday times, but we feel like there are opportunities for us to improve the rate and amount which we communicate out on a targeted basis. We will continue to push. We will continue to communicate out broadly to our people about this initiative because we have seen progress and results over the course of the year that we've been tracking. And so we feel pretty good about where we are, and we're not, like I said, not anywhere close to that 80%, but at least we're moving in the right direction. We love our partners. The American Cancer Society has been fantastic in opening up resources and helping us to find direction in this. And so I think as a final note, we're going to leave that as our charge is take advantage of these resources that you have, partner with the American Cancer Society, and keep on pushing because as you do, good things happen. Thank you. Shelley, I think you might be on mute.
Oh, thank you, Levin.
You bet.
Thank you so much for sharing what you've been doing at AT&T. We have one more company that we're going to hear from, and that's Progressive Insurance. And specifically, we're going to hear from Kimberly Smoley and Linda Rousey. Kimberly Smoley is the Health Service Operations Manager. She has been a nurse in healthcare for over 25 years with experience in oncology, pediatrics, ophthalmology, and family medicine. She earned her MBA in management from Baldwin-Wallace University. Kimberly joined Progressive in 1997 as a triage nurse and served as a clinical manager for 8 years and have managed the operations of Progressive's clinics since 2005. Linda Rousey began her career as a clinical audiologist almost 35 years ago and has held various healthcare management positions at several northeastern Ohio organizations for the last 27 years. Linda joined Progressive in 2006 as the Compliance and Wellness Manager for Progressive Health Clinics. So we are ready to hear your story. Kimberly, go ahead.
Okay, great. Thank you very much, Shelley, and Alex, too. Linda and I are really pleased to be here today. As Shelley mentioned, we are employees at Progressive Casualty Insurance. I think at this point, probably most people on the call know Flo in some capacity, and that is the company who we've worked for quite a long time. We celebrated our 80th anniversary this year, and we have about 34,000 employees, and we continue to grow, probably adding a couple thousand more by the end of next year. We are self-insured and cover about 57,000 lives of our people and their families. And true to our name, we are progressive in nature, so we have offered some form of wellness or healthcare program for the last 30 years, far before it was kind of in vogue to do so. And that was not occupational health, it was true healthcare. Our founder was friends with Peter Lewis. He was a physician, and he came with this concept of wellness, and it's developed now into the 5 clinics. So we have 5 bricks and mortar clinics in 4 states across the country, though Progressive has offices in every state in the nation. And we actually recently began offering telemedicine services at 3 of our clinic locations as well. So we are a patient-centered medical home, voluntarily accredited by the Accreditation Association of Ambulatory Healthcare. And we employ physicians, nurse practitioners, physician's assistants, nurses, massage therapists, and other ancillary staff to provide primary care and incidental care to the Progressive employees and their covered dependents. Health Services completes approximately 40,000 visits annually, and we have about 10,000 patients attributed to our clinics as primary care patients. So we've come at it from a little bit different perspective, if you want. Thanks, Shelley. And truly, while we are part of the benefits department and work with the benefits team, we also have the clinics on site, and so we look at this from a healthcare healthcare standpoint as well. So we've partnered with the American Cancer Society for many years to improve awareness at Progressive all cancer screenings. And we utilize media such as our company-wide newsletter called The Pen to educate employees, but we also have various digital media options. We've got Progressive TVs all around the company, and we also have a Twitter feed that we commit to. So we actually feature many of the services internally in health services, and one of those examples is we offer the on-site mammography screening in multiple locations where we bring mammography to the women at the campus. We knew that we needed to also really focus on our colorectal cancer screening rates for our attributed patients, and we were about 48% when we started looking at it very closely and looking at this commitment to wipe out this disease. So also in March, which is the Colorectal Cancer Awareness Month. So March 2015, we started working more closely with our benefits team to identify our at-risk patients through claims information. And we also have internal analytics that we run since we have our electronic health record. We identified 625 folks, and these are the folks that we manage as healthcare people that really we wanted to call to action, and we co-graded the letter with ACS and thought, this is great. We're going to give this everyone a single person to call in health services. It's going to be really personal. They're going to love it. They're going to respond. And we got about a 3% response rate, which was, of course, a little deflating. The other thing we did during that time was there's a DVD talking about colonoscopy, kind of demystifying it, and we ran that in the waiting room on a loop, and certainly our front desk was very tired of hearing about it, but they all got their screenings, and so that worked out really well. So we knew then that also the other way to talk with our people, because again, we're healthcare folks, so we really also made the commitment to educate our patients during our one-to-one exams, as well as during incidental care visits. So when we really kind of decided, all right, this response to the letter was pretty low, we really stepped back and we started thinking about it from what the patient perspective looks like. And so we really identified some barriers that we thought or found that would prevent people from being screened, and you all know them. Fear, the prep is horrible, the time it takes to be away from work. And we realized that internally we had this all or nothing mentality where we were pushing the colonoscopy, but there are other less invasive options that people may be more interested in trying. So we changed our focus a bit to educate about the FIT testing. And we had done guaiac-based testing for a while, a long while, but then as the immunochemical testing became available to us, we switched to FIT kits, or FIT testing, and we would put these little kits together in brown paper bags, give them to the patients, and we started thinking about, okay, how do we get more engagement? And so the FIT kit for Fitbits was born. And so what you see on the screen is the poly bags that we made up and also the little card that the person would fill out. So that card was attached to the screening cards, and they would fill it out, and they would come back with the cards, and we put them in a drawing. We also made sure that if we received a colonoscopy report, we made sure that person was entered in the drawing, or if they said they were going to go for a colonoscopy, we gave them one of the cards as well, because we wanted to include everyone. So again, knowing that people respond to tchotchkes and rewards, we said any people that returned their kits, we would enter them into a drawing, and we did that on a quarterly basis at every location. So 5 locations, 5 drawings, and we really had a lot of response. People had a really good chance of winning that Fitbit, and they liked that a lot. So we knew that that was kind of a driver of success. So that's what our promotional items looked like, and then we also really made it an informal competition, if you will, with our staff. We've got 2 campuses really close together here in Cleveland, but around the country the staff were really engaged because they were trying to collect as many cards as they could, and that also improved the campaign kickoff. So the next slide is really just a simple PowerPoint sign that we made up with the progressive colors and set them in the waiting rooms, put them at the front desk, put them in the exam rooms, and it's really just a demonstration of you don't have to spend a ton of money to catch people's eye and to get people engaged. And so this, again, very simple PowerPoint posters that really helped the campaign move along. So with the next slide, we started tracking our success, right? So we relied on our staff to promote the program and word of mouth and the signage, as well as our providers in the exam rooms. We entered folks in the drawings. You can see we started middle of Q2 of 16, and we ran that out over several quarters. And in the end, we actually had 155 folks screened, or approximately 25% instead of that 3% that we saw in March a year and a half earlier. So we are very pleased with that outcome. During that time, 2 of the folks that submitted kits were positive, and we sent them for a referral for their colonoscopy, and we're actually awaiting the outcome of those couple of screenings. So as we look at the next slide, then we see that, and as you saw before, the participation started to decline over time. So now we're a little bit over a year, and we're thinking, okay, so how else can we engage or re-engage patients? And what we realized is some patients, even though we told them, some patients may not know that the FIT testing is really an annual test. So we thought, all right, we've got to get those people back in, and then we're seeing new patients all the time. So we decided to do something a little snazzier, and we are doing this Watch Your Health, where they could win an Apple Watch. And so again, just examples of the poly bags and the sign that we made up, and really we're relying on our signage, our word of mouth, staff promoting it, and then the one-to-one education that we're doing in the exam rooms. So after 7 weeks, we had collected 16 entries already, which again, if you do the math, it's probably going to be a really similar number that we ended up with the first round. But we also have a special reminder letter that is just a little example in our EHR, where we have a regular annual reminder letter, but then we made one just for FIT testing so that it called out, hey, it's annual, and this time you can win a watch. So let us know if we can send you a kit, or if you'd rather do a colonoscopy, that's great too. But this is kind of our newest campaign, and so we'll see where that goes. What we want to do, what we will do, is track participation of the patients that have already come once, as well as how many new patients we've engaged since we moved into this phase of the campaign. So just to summarize then, we want to remind everybody, yes, 18's looming, but it is a marathon over time, right? It's not, we're not going to just zoom up and get to our percent. As a company, we've got a 62% screening rate from the data that we've pulled from our Aetna, our health plan, and so that's great, but we know that we can impact that just with our small clinics and move that number up. But we're also looking at doing something on a broader scale, taking these learnings and trying to do something on a broader scale within the company. So our biggest challenge, of course, everyone's challenge, is engaging people, getting them to buy in, especially when the subject is as unpleasant as this is. Certainly we, again, the tchotchke thing, offering an incentive or something they could reward and try to make it as easy and appealing as possible. Certainly, as everyone has indicated, all the multidimensional communication plan works the best. Everybody receives information in a different way or responds to information differently. So using many modes of communication is important. And then we started applying what we learned to some other incentives that we're offering on site, such as we brought home sleep testing, where people can do the sleep testing in their own bed for sleep apnea. And people are really engaging with that because the barrier of having to go to a lab has been removed, and there's been no incentive at all for that. And then we also have a pre-diabetes program that we're launching with the Y, and again, as we try to get our pre-diabetics engaged, kind of rewarding them, entering them in drawings, and just, again, simple campaign posters and whatnot, we're going to kind of do that same thing. Most of us have had some personal attestation to the value of screening, and I am no different. We actually, as we were rolling out the new FIT cards, some of our staff were performing them to, try them out and see how it went. And my husband, I took them home to my husband, and he left them on the vanity for about a year, actually, even though I kind of prompted him. And at 51, was diagnosed with stage 3 rectal cancer after he was kind of forced into colonoscopy because of symptoms. So, hindsight's always 20/20, but truly, if he had the cards, might not have been stage 3, and, chemo, rounds of surgery, lots of money, and lots of heartache. The cards are such a simple way to call something out and to avoid a lot of this, and even he now will agree, and he is one of the biggest advocates at his place of work to try to get folks screened. So, Linda, did you want to add something?
The only thing I wanted to add, hi, this is Linda Rousey. I can't stress enough, if you're unsure of where to start or how to start, get in touch with your local or your regional ACS staff member. We started working with ours several years ago. Even if you don't have your numbers together, just start talking with that ACS representative, and just goes a long way in partnering with them to help you with resources and materials. And we look forward to working with the ACS on other projects in 2018. That's it.
Thank you. Thank you.
Thank you so much, Linda. And Kimberly, we're glad that your husband has finished his treatment and is doing good. Yes?
Thank you. Thank you.
Yes, that's great. All right, so let's move over to hear some news, some 80% pledge news. And we have Mary Doroshank, who's the Strategic Director of Colorectal Cancer Intervention at the American Cancer Society, and also the Director of the National Colorectal Cancer Roundtable, or NCCRT, which you've heard that acronym a few different times over the course of our webinar. The NCCRT is an organization that's co-founded by the American Cancer Society and the Centers for Disease Control and Prevention to bring like-minded organizations together for the purpose of increasing colorectal cancer screening rates. So, Mary, go ahead.
Yeah, thank you so much, and what amazing presentations. My hat's off to Progressive and AT&T and Amarin, just such wonderful array of work. Just so impressed and appreciative of your commitment to this cause. Next slide. So Shelley asked me to talk a little bit about what happens next. I mean, if you look at your calendar, you can see that we're very close to 2018, and this effort has been focused, of course, on our goal to get to 80% by 2018. And so, what does that mean for our campaign? And if you've ever heard our Chief Cancer Control Officer, Rich Wender, talk, he will tell you that this campaign runs through December 31st, 2018. So we definitely have another year under this umbrella campaign. And so we really want to make the most of that year. So he is challenging all of us to act with urgency, even as our calendars are turning. Having said that, we're realistic as well, and we want people to continue to be a part of this effort. And, if you started in 2013, you're probably in pretty good shape and have had time to make good progress. But if you're just starting now, we don't want that 80% by 2018 deadline to be daunting to you. So we've sort of taken a temporary change to our campaign, and we're calling it just the 80% pledge right now. So, you don't have to feel bad that, gosh, I can't get my company to 80% in 1 month, so I'm not going to sign the pledge. We welcome everyone to join in all starting points, and we're getting rid of that sort of artificial deadline for the time being, so that, people feel that they can certainly join our efforts. We also want to make sure, as we sort of continue our work, that we celebrate our successes. And boy, today was a great example of all the good work. Can you go back one more, Shelley? To celebrate our successes. Because today was just a great example of all the great work going on. And, we are so proud of all the types of changes and all the progress and all the investment and times and resources that different organizations who have signed the 80% by 2018 pledge have made. We're celebrating on a national level a steady increase in screening rates, and we want to celebrate individual wins as well. We also want to hear about what you all think should come next. Without a doubt, something is going to come next. You have told us that you are just now hitting your stride and learning so much, and we don't want that to stop. So there will be a new initiative come January 1st, 2019, but we really want to pay attention to what you have to tell us about what you liked and what you didn't like about the 80% by 2018 effort and how we can make it better. So right now you'll see the link below, nccrt.org/beyond2018 FAQ. If you go to that website, you'll see a big orange button where you can take the Beyond 2018 survey, and you can give us your feedback about what you'd like to see comes next. And finally, be ready for something new. As I mentioned, we've been so proud of all the work underway, and we want to continue momentum on this important goal. So we're in our listening phase now, but come spring of this year, we'll begin to roll out a new phase of our work. So please tell us what you want to see while you can, and we're going to be taking that information, listening to it, and shaping our next campaign. Next slide. And then going along the lines of sharing your success stories, I just wanted to make sure everyone was aware that we do have an 80 by 18 National Achievement Awards program that has small grants to the winners, but we really want to recognize organizations that have invested in this effort. And I think the three folks presenting on the call today should certainly self-nominate. It's a very simple process. You go on our website to fill it out. You can either nominate or self-nominate. And this is not just for organizations that have actually hit 80%. We certainly want to recognize those who have made really good strides because we need all organizations at the table, starting from whatever number. If you're starting with a lower screening rate, we probably need you more than you need us. So please do join this effort. And if you have a success story to share, nominations are open through December 11th. And that is it, Shelley. I'll turn it back to you.
Thank you so much, Mary. So now we want to open this up to answer some of the questions that have come in. If you are on the call and you had a question, if you look to the lower right-hand side of your screen in the Q&A box, you can enter it there. And I'm going to go ahead and go through some of the questions that have come in. There was a question about the URL that was in, I think the URL they're talking about is the one that was related to the statistics that our intramural research team did on occupations and colorectal cancer screening prevalence. That URL will be available in the slide deck, and again, the slide deck and the recording of this webinar today are going to be posted on the NCCRT website. If that isn't live by tomorrow, it should be live by Monday. If that's not the URL that you're talking about, please go ahead. If you're talking about the Make It Your Own website, it's MIYOWorks.org, and that's the resource that you can use to make customized messaging for specific populations, drop in imagery that makes sense for the group that you're targeting, your specific call to action, and those types of things. All right, so the next question, and this is open to all of our employer presenters, is do you have any information as to how these efforts have helped or will potentially help reduce healthcare costs for the company, either in terms of avoiding cancer treatment costs, lost productivity, et cetera?
I'll speak up and take a stab at helping kind of get our heads around that. Now, that's something that we look at closely here at AT&T, obviously, but one of the big things that we need help with understanding is what percentage of screenings results in a diagnosis or a catch, an early catch, and that's something that I had a hard time finding when I was preparing to speak today. But yeah, I mean, obviously there are answers to that question as far as catching it early versus somebody who goes their whole life or goes through the diagnosis. I believe I saw the number was somewhere to the tune of $500,000 a year for fighting it actively. Is that?
That's right.
Yeah, something like that. So every one person that you catch, right? Like every early detection / prevention that you ultimately detect in one of these screenings, could be looked at as saving the company, whatever, $500,000 minus the cost of the test, right? So it's I'm sure you can run thousands and thousands of tests until you recoup the cost of one early detection. So I don't know. It's an easy win when you can prove that there are people catching early signs. I know it's not a great perfect number answer, but you know, we definitely consider it a win to have our people screened.
Thanks. And thank you, Levin. And I think Progressive had just mentioned that out of the screening toolkits that they did, that 2 came back with questionable results or something that needed to follow up with a colonoscopy. Is that correct?
Yeah, that's correct. I don't have the outcomes of those colonoscopies yet, but again, you know, I would say the same thing that Levin said. You know, the math is simple when you know what one cost you, and then you know, have to find the incidence of the polyps, let's say, and kind of run that against that. But I don't really have anything else to add to that.
All right. So I have a question about how if the campaign is something that you really target around Colorectal Cancer Awareness Month, or is this something that you do year-round?
So go ahead, Lisa.
Okay, thank you. I'll just say that we have been doing year-round efforts. We definitely use the month of March with the heightened awareness around colorectal cancer, and always have tried to do something special during that month, but throughout the year we're trying to make sure that the messages are going on continuously, so that as people age in, you know, they didn't hear the message right now, maybe they'll pick up on it and take action the next time they hear it. So we're trying to just have it very, very prevalent on an ongoing basis.
This is Progressive again, so I was going to say the same thing. It's ongoing, it's year-round. We get lots of new patients, lots of new employees, so, and they're all ages and ethnicities, so it's you're going to catch somebody or capture their attention. To do it just, you know, in the month is probably missing a lot of opportunity over that time. So if you can do it all the time, and to your point, maybe not as big a splash, but certainly it's valuable year-round.
All right, well, thank you. It looks like that that will wrap it up for the questions. And I see that we have 2 minutes left, so I wanted to have some time to talk about the resources that are available. One of the questions asked what that website that I mentioned at the beginning of the call. It's there on your screen, NCCRT. Just wanted to let everyone know that if you can reach out to us, to either your American Cancer Society staff partner with any questions that you might have, and also to get your own 80 by 18 employer challenge guide that can help walk you through the 5 steps of success that we talked about today in more detail. If you're not already working with a staff partner, you can email us at acsworkplacesolutions.com, and we can connect you with someone. Also, you can visit NCCRT for more resources, including the communication guidebook that we talked about earlier, or you can go to cancer.org/colon for general information about colorectal cancer. I wanted to thank Alex Bohm, Kelsey German, Noelle Heavner, Emily Butler-Bell, and Emily Butler-Bell from ACS for serving on the planning team for this webinar. And I want to give a huge thank you to Lisa Rosalind, Levin Gunter, and Kim Smoley and Linda Rousey again for all of your help and your presentations today and sharing your stories, which are so helpful to companies that are out there that are trying to get started. Sometimes just being able to see what someone else did can help kind of move you over that hump that you might be on. So we really do appreciate it. There's going to be some questions at the evaluation questions at the end of the webinar. We'd really appreciate if you take a moment to answer those. And again, a recording of the webinar and the slide deck will be posted on nccrt.org either tomorrow or at the latest by Monday. And just want to thank you all in the audience for joining us today and your interest in the 80% pledge for colorectal cancer screening. And I hope you all have a wonderful day.